Connection between diabetes and depression. Living with diabetes can be troublesome and cause anxiety, with the ongoing demands having an adverse effect on your mental health. As a result, a lot of people go through distress, mood swings, and crippling levels of anxiety. Disorders of mental health can make it more difficult for you to manage and take care of your diabetes. As with your physical health, it's crucial to take care of your mental health as well. Common emotions related to diabetes. A wide range of feelings, including shock, anger, sadness, and fear, are likely to come over you when you receive the diabetes diagnosis. As you adjust to having a chronic illness, it is common to experience these feelings and go through numerous emotional stages. You're on a higher chance of developing depression if you have diabetes, either type 1 or type 2. Additionally, your risk of type 2 diabetes may be higher if you're depressed. The good news is that depression and diabetes can be managed simultaneously. Your physical well-being can be influenced by your thoughts, feelings, attitudes, and beliefs. Diabetes complications and untreated mental health concerns can both exacerbate each other's effects. Fortunately, though, when one gets well, the other usually follows suit. According to studies, diabetics are more likely to have depression symptoms. Although there aren't any conclusive explanations for why this occurs, experts provide a variety of explanations, including 1. Because type 2 diabetes is a chronic condition. Many people experience depression as a result of managing its symptoms over an extended period of time. 2. For the patient, situations in which the blood sugar level has risen to the point where nerve damage has occurred can be incredibly frustrating and disabling. 3. As a result of this disease and potential exhaustion from the lingering symptoms, you may feel distant from your family and friends. 4. Stress is a significant element that both illnesses share. Stress increases body inflammation, which can lead to depression and diabetes. 5. Long-term illnesses frequently give patients the impression that they have less control over their bodies and are more dependent on others. Depression can lead to bad eating habits, decreased exercise, smoking, and weight increase, all of which are risk factors for diabetes. Depression impairs your ability to complete things, interact effectively, and think clearly. This might make it difficult to control your diabetes successfully. Depressed people have higher amounts of stress chemicals like cortisol, which can lead to difficulties with glucose or blood sugar metabolism, increased insulin resistance, and abdominal fat buildup, all of which are diabetes risk factors. What is the link between diabetes and depression? Diabetes, whether type 1 or type 2, increases your chance of getting depression. And if you're sad, you're more likely to get type 2 diabetes. The good news is that diabetes and depression may coexist, and controlling one properly can have a favorable impact on the other, though the connection between diabetes and depression is not completely understood. Diabetes management can be stressful and result in depressive symptoms. Diabetes can lead to difficulties and health issues, which can exacerbate depressive symptoms. Depression can lead to bad eating habits, decreased activity, smoking, and weight increase, all of which are risk factors for diabetes. Depression impairs your ability to do things, communicate effectively, and think clearly. This might make it difficult to control your diabetes successfully. Managing both illnesses concurrently. Diabetes self-management programs, diabetes programs that focus on behavior, have proven beneficial in assisting patients to improve their metabolic control, raise their exercise levels, and manage weight loss and other risk factors for cardiovascular disease. They can also help you feel better and live a better life. Psychotherapy. Participants in psychotherapy, particularly cognitive behavioral therapy, have experienced reductions in depression, leading to better diabetes control. Medication and lifestyle modifications. Medications for both diabetes and depression, as well as lifestyle adjustments such as various forms of treatment along with regular exercise, can help improve both disorders. If you have diabetes, be on the lookout for signs and symptoms of depression, such as a loss of interest in typical activities, feelings of despair or hopelessness, and unexplained medical issues like back pain or headaches. Diabetes causes suffering. Diabetes distress is a separate condition. It leads you to have helpless sentiments of despair as a result of your diabetes. You may believe that your efforts to manage your diabetes are futile. You may possibly believe that you have caused and other ailments connected to your diabetes. People frequently believe that their diabetes controls them rather than the other way around. Stress causes a rise in the hormone cortisol in the body, which can tell the body to release more glucose, resulting in higher blood sugar levels during these periods. Furthermore, your diabetes management routine may be influenced during times of stress, such as eating more or exercising less, and it is important to recognize this. As a result, it is critical to check your levels more regularly to ensure you are still reaching or maintaining your target levels.